Good evening. My name is Jamise Terry, and I am submitting my video blog, question number 1 for Infm, Information Management, 645 at Emory University for Dr. Bascaron. The risk management process consists of 4 different stages. First, you must identify and qualify the risk. Then, secondly, decision-making process must be, must be evaluated to recognize what the appropriate risk management reaction should be, meaning their treatment. And then thirdly, an application of suitable controls to achieve these objectives identified in number 2 should be established. And of course, in number 4, there must be acceptance of the residual risk following the implementation of those controls. We were asked to consider in the healthcare management information in healthcare, an information system that is currently being used, and identify a risk and navigate the steps that I have already mentioned for that risk in the management process. One of the things that I think of when I think of the risk management process in my current job involves the clinical physician order entry via our electronic medical record system. What happens is the physician usually will go in and enter orders for things from medications to procedures and also potential blood transfusions and products. And in that system, there is a high risk of error on the part of the physician or any user, really, because they can potentially enter an order for a patient that may have a potential drug interaction or a potential blood reaction to a different for incompatibility. So say a patient is O negative and a physician orders not O negative, but say that they're AB positive and the doctor orders blood products for them and they order in error the incorrect type. There's a potential for a blood transfusion interaction. So with the CPOE at my job, there are hard stops in the system that will prompt the physician when they're entering in orders to recognize that potential. So for example, if a patient comes in and they have an allergy to ACE inhibitors, a potential blood pressure medicine, some people have allergic reactions to those ACE inhibitors. Say the physician comes in and they order an ACE inhibitor, the system will prompt the physician that, hey, this patient has an allergy to this medication. Are you sure you want to proceed? So it asks them if they want to proceed. So the physician will have to say yes or no in order to bypass the system. So with the clinical physician order entry system, when it was built, there were hard stops put in and also links to potential for the policies, if any, that were related to that order. It is also through exposure avoidance that these risks can be reduced to the possibility of 0. However, there is still a small risk even with the systems that are being put in place. That's why we have the checks and balances as well, both through the EMR system and through the staff education and through policy review and revisions. In my job, policies are usually updated at least every 3 to 5 years with new evidence-based medicine and practices. And although the risk cannot be eliminated through the use of the EMR and CPOE with hard stops, checks for potential adverse reactions, the risk to the patient can be limited to near zero. Thank you and have a good night.